Most of us learn about sexual health through awkward whispers, frantic internet searches, and the stylized depictions of pornography. When those systems physically break down, that lack of real information is quickly replaced by intense cultural shame. For decades, the scientific establishment minimized the female sexual response. This dismissal created a lasting bias, treating female arousal as a secondary or psychiatric concern, rather than a complex biological process. Conversely, history reflects a fixation on male physical arousal. The erection has been treated as a standalone indicator of health and status for centuries, placing immense pressure on a single physiological event. We treat pain, urinary issues, or erectile dysfunction as isolated failures of our reproductive organs. In reality, these symptoms are clinical warnings of a systemic breakdown. Urological and sexual health provides a clear window into your overall physical state. This entire process is governed by three systems: the pelvic floor, your blood flow, and your brain. The foundation is the pelvic floor, a bowl of muscles anchored to your pelvis, supporting vital organs in both males and females. This muscular sling directly controls urination, defecation, and sexual function. If these muscles lose their functional range, the organs they support inevitably struggle. The standard advice for pelvic issues used to be a universal prescription of Kegel exercises. However, indiscriminately flexing these muscles can actually worsen many urological conditions. Chronic stress, sedentary sitting, and overtraining without proper breathing can leave the pelvic floor hypercontracted. The fibers become short, rigid, and unable to rest. This persistent tension manifests as urinary urgency, painful intercourse, and is a primary cause of erectile dysfunction in young, otherwise healthy men. For many suffering from pelvic dysfunction, the path to recovery isn't more strength training. It requires the mechanical skill of consciously relaxing the entire system. The second system is the vascular engine. Physical arousal is a measurable cardiovascular event. The clitoris is the exact anatomical homologue of the penis. Both are spongy erectile tissue, and both require significant, sustained blood flow to achieve engorgement. In both sexes, physical response depends on releasing nitric oxide. This chemical signals blood vessels to expand, allowing rapid inflow. Data shows that hormonal imbalances like low testosterone account for only 3 to 6% of erectile dysfunction cases. Most physical sexual dysfunction, including erectile issues and a lack of lubrication, is the result of cardiovascular roadblocks. High blood pressure, diabetes, and smoking damage vessels, stopping the physical response before it starts. Difficulty with physical arousal indicates a mechanical restriction within the body's plumbing. The vascular engine has encountered a cardiovascular obstacle. Our clinical understanding comes from researchers William Masters and Virginia Johnson. They mapped the phases of excitement and plateau, establishing a baseline for sexual function. Their work highlights a critical distinction: psychological desire, the mental want, and physical arousal, the bodily response, are separate processes. They do not always occur simultaneously. The brain manages desire through the hormone testosterone and the neurochemical dopamine. This neural command center determines our interest in seeking out intimacy. The autonomic nervous system handles the physical execution. Response requires the parasympathetic mode, a state of relaxation. It is directly suppressed by the sympathetic mode, the body's fight or flight response. Chronic stress or performance anxiety triggers that sympathetic response. The nervous system then actively diverts blood flow away from the pelvis, neutralizing physical arousal even when psychological desire is present. The brain is the most powerful sexual organ in the body. If it perceives a threat, whether it's a life stressor or just anxiety, it will override the vascular and muscular systems to prioritize survival. Daily habits directly dictate your sexual and urological function. Sitting at a desk for hours while managing high-pressure tasks attacks the biological trifecta. Inactivity stalls the vascular engine, while mental stress keeps the pelvic floor in a state of hypercontraction. We often try to force solutions that cause further damage. Blind Kegel exercises can worsen existing tension, and douching destroys the vagina's necessary microbiome. Biologically, the vagina is a self-cleaning oven. Supporting this system requires a multi-pronged approach: cardiovascular exercise to maintain vessel health, mindfulness to lower sympathetic dominance, and specialized physical therapy to stretch and align the pelvic floor. Pain, leakage, or sudden dysfunction are clinical indicators of a specific biological disruption. Once we understand the interplay between muscles, blood, and the brain, we can replace stigma with targeted, lifelong wellness.